I'm the conductor of the Gerber Medical Clinic, offering full-service integrative modalities and has strong ties to biological dentistry. Without further ado, let's welcome Dr. Gerber.
Thanks, Vic. Well, as you see, I really appreciate the opportunity to talk with you all today. This is built for kind of docs, but I hope that you find some interest in it. Looking around, I think some of us are of age to enjoy the benefits and reap the harvests of bioidentical hormone replacement therapy. There's 3 22-year-olds out there that may leave. No, brother. So as you can see, this talk was meant to go off in a couple of weeks in San Francisco at the Orthomolecular Health Medicine Convention, which we encourage you all to come to. And I've been participating with those guys since '76. So time rolls on. In any event, there's a ton of things to talk about in the world of hormones. And I'm not going to get through nearly all of this today. I'll try to get down through testosterone so you guys don't leave. So thyroid, adrenal, progesterone, the girls, the guys, and the both, and HGH and melatonin. So we'll try to pick out a few highlights of all these things. Try not to beat them all to death, except I will, probably. And please do interrupt me for questions. So by the time we hit 40, all of our hormones are at half or a third to a half or lower levels than when you're 25. So we're all losing hormonal power, and many of the diseases of aging are associated with this hormonal decline. And there are 2 schools of thought. You can put it back or don't put it back. And we're in the put them back school of thought. It makes your quality of life so much better, more youthful, more athletic, less illnesses, more sexy, and better able to give your patients great service over the years. When you're feeling good and your energy is good and your vibe is good, you can do a lot better healing. To remember that we are living in a toxic world. I like the book Detoxify or Die by Sherry Rogers. If you've never gotten through that book, Sherry Rogers, a little fireball from Sarasota, Florida. And by the end of that book, she will convince you that we are all 100% of us extremely toxic to at least 100 chemicals. And really the only way of getting those guys down is far infrared sauna. So in our new office, we have a medical spa where we have 2 boys and 2 girls saunas, where we routinely help people to sweat because you can't get out the plastics and the pesticides and the volatile organic hydrocarbons and also heavy metals without routine sweating. And older folks don't sweat much. And some don't sweat at all. And sometimes it takes 3 months to a year to get elderly folks to sweat. And it's quite amazing when this does start happening, because otherwise we can get the heavy metals out by chelation, but you can't get out the pesticides and the herbicides without sweating. And we've been alluded to all the leaky guts, our very stressful lifestyle, our cortisol dominance, our sympathetic dominance. All of this upsets the hormonal balance. Now we have to tip our hat and pay homage to the ANS, the autonomic nervous system. This is the big guy on the block that runs everything else. And the autonomic nervous system, of course, is very intimately related with neurotransmitters. And your neurotransmitters, which all decline with age also, are running your hypothalamus, which is running the pituitary, which is running all your peripheral hormone organs. So neurotransmitters are big. The hormones regulate all your DNA and RNA. They turn on all your synthesis of DNA, especially thyroid. It's highly related to your DNA and RNA synthesis. And all your mitochondrial energy production is closely related to your thyroid activity. Declines with age, declines with a bunch of stuff that we will look at. It also helps organize our membrane pumps, and sodium potassium balance, and our electrolytes are also very much regulated, especially by our adrenal hormones and aldosterone. Just once again to say that it's the most gratifying thing to do. It's the fastest thing that you can do to make somebody feel better, in my experience, besides good lifestyle, good diet, exercise, meditation, yoga. There's so many things that help us. But if you really want to change chronically ill people, it's hormones that do the job. And you can do it rather quickly, and it's rather dramatic, and you'll get people's attention. And this is probably good. And besides, it's just rebalancing the whole system, make people feel good. And again, people lose weight, improve their sleep. You can totally get rid of PMS and all women's symptoms. Lost sex drive. So many women have never, ever had a libido, ever. And probably maybe a quarter or a third of women I see never have had a sex drive, ever, ever. And to get it back, their husband sent me flowers. They're so thrilled to get back into the sexy business, and their husband go, my God, what happened here? Especially after childbirth, the women's hormones really go down, especially thyroid. Pretty much all of postpartum depression, I feel, is hypothyroidism, hypothyroid. When the baby's thyroid makes antibodies against the maternal thyroid, frequently goes down, along with other hormones. And also, we're not going to hit them all, but I've just preparing for this talk, I've been to three and 4 day seminars in the last 2 months in regards to bioidentical natural hormone therapy replacement. And I come away with renewed confidence of safety and efficacy, but primarily safety. Wonderful studies have been done in the United States and Europe and Canada that absolutely show very clearly the safety of bioidentical hormones when they're properly done and properly in balance. It's like anything. This is just like dentistry. This is artwork here. This is an art form. And to balance, get everybody balanced and all the hormones balanced requires expertise and a lot of time and listening to the patient very, very carefully, because they'll tell you how their hormones are doing. And you all know hypothalamus, pituitary, thyroid, pineal, thymus, adrenal, ovaries, and testicles, you know those guys. So hypothyroidism has many, many levels of it. Loss of libido, difficulty conceiving. Of course, menorrhagia is greatly overlooked. People, the gals with huge, heavy periods, and nobody's ever thought to look at their thyroid. We see many endometrial ablations that are absolutely needless that are taken on because of low thyroid. And hysterectomies. We don't find any fibroids in you, Mrs. Smith, and we just don't understand why your periods are long and heavy, but I'm sure you're sick of it. Let's just take out your uterus, and that will solve the problem. Depression, especially postpartum. Low thyroid, again, thyroid governs all of your DNA and RNA and mitochondria. It makes the mitochondria not only grow in number, but grow in size. They become larger. And your mitochondria are making your energy power plant of the cell, and they're making ATP. And if it's like turning down the volume on the TV or your sound system, it just turns the whole energy down when the thyroid's down. And of course, sensation of cold, loss of hair, edema of the eyelids, decreased sweating, course of the hair, pallor, skin, memory impairment, constipation, hypochlorhydria, shortness of breath. Dyspnea is also another symptom of hypothyroidism. Another nice thing about the hypochlorhydria aspect, it turns people's digestive systems back up. Not only will it cure very chronic constipation, but it also helps turn up that stomach acid. And so now you're going to absorb your amino acids that are building your neurotransmitters, and you're going to make all your albumin that's running everything in your body, and absorb all your trace minerals. And so it turns up the whole absorption when your thyroid's properly in balance. Peripheral edema, hoarseness, aphonia. How many people said, guys, I get older, I'm hoarse. I don't know why I'm hoarse. I've been to the ENT and my cords are just fine. But it's thyroid. Deafness, precordial pain, morning stiffness, numbness and tingling of fingers, apathy, I can't get out of bed, listless, anemia. These are all low thyroid signs. And we could spend all day talking just about thyroid, absolutely. We are way out of the box on diagnosing thyroid as far as only looking at laboratory testing. Laboratory testing is fraught with many confounding issues that we'll try to talk about very briefly here today. And it's all started out pretty much in our modern era with Rhoda Barnes, who started in the 1940s, wrote his book, hypothyroidism, the unsuspected illness, in the early 1970s, and met Broder Barnes at a ACAM, that was AMPS meeting, and he was in his 80s at that time, still taking 3 grains of thyroid and 5 milligrams of prednisone. Kind of a jolly red-faced guy, was still cranking along. So he always likes to check underarm temperatures in the morning, and you try to hit 98 degrees under the armpit. Many people will be 94.2, 94.6, 95.3, 95.8. So many people are unbelievably cold. The axillary temperatures are taken because the thyroid also controls the temperature to the skin. But you will find the oral temperatures are low as well. Well, as for those of us who do Chinese pulses, there's no triple warmer pulse frequently, which is the third one up on the right, superficial. Diminished or absent Achilles reflex. There's an old machine called a photomotogram, where you have the patient kneel on the chair and put this little machine on the strap to the sole of the shoe, hit the Achilles reflex, and it measures the arc and the surface area underneath the return. And you basically can feel this slow return. But it's even more obvious when there's no reflex at all. Many people are areflexic, low thyroid. High cholesterol. Used to be in the old days they didn't have thyroid tests. So they just figured anybody's high cholesterol is low thyroid. And it really lowers cholesterol dramatically in people getting an adequate amount of thyroid. Puffy. Well, I have some pictures here my wife wanted me to take. I took them out from my other, this is not my real presentation actually. But I took these out. You'll see this puffy appearance, and I can spot mixed edema and a block. Puffy eyes, depth of lines, it's puff. Well, I'm just getting older. I'm just older, and I'm just supposed to look puffy. No. You should have jawbones and cheek lines and upper eyelids. You should be able to see through this. And not everybody's is puffy, but many people are puffy. Low blood pressure, normocytic anemia. They're not iron deficient. The cells are not too small. They're not too large, not B12 or folic acid deficient. There's just not enough of them. It is a thyroid deficiency. And may have normal or low blood tests. And here's good old Broder Barnes, Fort Collins, Colorado, bless his soul. There are many books on low thyroidism these days. I don't know if you're interested in all this testing stuff, but we do like to do TSH, but we don't rely on it. Total T3, T4, free T4, total T3, free T3, and thyroid peroxidase. Many people have antibodies against the thyroid, again, especially after pregnancy, or they can inherit it, or it's an overlap with leaky gut and other inflammatory processes in the body. Ferritin, vitamin D, and we've learned just in the last couple of years that vitamin D is in charge of thyroid receptors, or it has to do with thyroid receptors. So if you turn up your vitamin D levels, and indeed we really these days are going to 5,000 and 10,000 IUs per day. I can do 10,000 in the winter and 5,000 in spring and summer. And this will just get your vitamin D levels up into the normal range. If you start checking your D level on patients, everybody's low. And T3 will beat you to death here, is the active thyroid at the cellular level. And you'll find thyroid uptake, which is not so interesting for you guys. If it's low, it means that T3 is high. If it's high, it means that T3 is low with lots of available binding sites. So you can calculate pre-thyroxine index. We won't get into this too very much. The deiodinases, you start out with thyroxine, which is a couple of tyrosines with 4 iodines on it. And then you have the deiodinases, which are all selenium-dependent enzymes. And so if you have selenium deficiency, you can frequently get the wrong kind of T3. Instead of getting regular T3 with a good guy, you can get reverse T3, which is the bad guy because it doesn't operate at the cellular level, but the hypothalamus still responds to it. So these are stereoisometric. So you have, it's like your hands. They're a mirror image in each other, and the body doesn't like reverse T3. It only likes the regular T3. So just depends on which pathway it goes down. So if we make equal parts of T3 and T4, I don't know if you're interested in all this stuff. So it makes a deep sighs if you move on. Whenever T4 is administered, depending on proper conversion of T3 to obtain the metabolic effects. And of course, it requires iodine, and there's a new spate of iodine books out there, especially one by Bronstein, which is very, very good, utilizing iodoral, which is 12.5 milligrams of iodine and iodide, citing the fact that your average North Islander Japanese consumes 13.8 milligrams of iodine per day, and your average American's about 0.4, 0.6 milligrams. A lot of people do better with more iodine, especially with any fibrocystic diseases, and fibrocystic breast disease, Dupuytren's contractures, Peyronie's disease, so the penis in the older guys. These things can all be helped with the iodine, iodide. Interestingly enough, we always recommend using natural thyroid, pig thyroid, as a starting point for therapy. Armor thyroid, we use Nature Throid, which has a little bit more T3 in it than Armor, and only has lactose and vanilla. One time, years back, the company left the vanilla out, and the patients all brought the thyroid back and said, "Doctor, this is rotten. It's not good." And so we like the vanilla in there. It does keep that smell down. So it's all the thyroid, and natural thyroid is bound on to thyroid binding globulin, thyroid binding prealbumin, and these help to also give it more of a time release aspect, which makes it a little smoother. T3 has a half-life of about 7 hours, and T4 has a half-life of about 4 days. So the T4 is gradually converted into T3. But basic stuff. "Doctor, I have cold feet all the time. I can't stand the cold." And the women who sleep in sweats and socks, that's sine qua non, man, thyroid. And again, I get flowers and cards from husbands whose women's bottoms are no longer freezing in bed. And it's very, very common. I think probably 8 out of 10 people I see like a little bit of extra thyroid in their system. This is some extreme myxedema. Loss of the outer third of the eyelids or the eyebrows. This puffy expression, tired, depressed, listless, and usually overweight. Makes a huge difference in the chronic fatiguers. So we like to always use natural thyroid and can always support the adrenal glands. So I've got this a little out of order here. Usually I support adrenals first, because if you give too much thyroid or too much thyroid too soon, it will crash the adrenal glands, and you can get an adrenal storm, adrenaline storm, with tachycardia, anger, nervousness, fast heart rate, insomnia, angina, headache, and your patients won't love you. The Wolff-Chaikoff escape effect, which we thought was a real deal for years, apparently is not significant for those of you who have studied iodine metabolism. Wolff-Chaikoff said you take so much iodine that you actually go hypothyroid. It's not really true. The problem with taking iodoral and iodine is that you precipitate hyperthyroid symptoms like this, and you have to reduce the thyroid or the iodine or both, or you'll have some really angry, freaked out patients on your hands. I do have maybe one claim to fame here, is Dr. Gerber's cup of coffee rule of thumb. And this is really tough with, it's tough with our LDSers, you know, people that don't drink coffee, but how can you stand coffee? How many cups of coffee can you drink, Mrs. Smith? "Oh, if I have a sip of coffee, I am up for 3 days. I cannot sleep." That person, you have to start at about a 16th grain of thyroid, or an 1/8 maybe, and you can take it up by maybe an 1/8 of a grain every week, 10 days, 2 weeks. Then there's a person says, the guy, 250-pound guy, "Well, I can drink a cup of coffee and go right to sleep." Then this is the guy that you can take him up to 3 grains of thyroid if you wanted to in about 2 weeks. But always start slow, work up gradually. Now, when you have problems with thyroid and making reverse T3 especially, slow release T3 is really good. It decreases the side effects, and it decreases the suppression of the thyroid and TSH. You can add other nutrients to it like cortisone, which we've always tried to use natural adrenal extracts over the years. But sometimes if there is a continuum of adrenal therapy. Some people require cortisol, and this really do. And other people can get away with adrenal extracts at a much lighter level. But you can add these in with your thyroid, and you can get compounded preparations of all these things. Just for amusement, a grain of thyroid equals 38 micrograms of T4 and 9 micrograms of T3. And levothyroxine, pentahydrate, and liothyronine sodium are bioidentical hormones. We just have been prejudiced over the years to natural thyroid. Once again, you have to address adrenal dysfunction before fixing thyroid function. If you have high cortisol, it causes excessive catabolic action on muscles and bones, and it also will suppress TSH. When you see somebody that looks absolutely hypothyroid and their TSH is really low, and their T3s and T4s are kind of low, it's this hypercortisolism from overstressed people. And again, low cortisol, adrenal deficiency cannot meet demands of increased metabolism. So if you turn up the metabolism with thyroid and there's not blood sugar in there from that adrenal gland storing blood sugar in the liver and in the muscles, then this person will turn into a raving lunatic, and they'll call you from the emergency room. Dr. Gerber tried to kill me with thyroid. And so this is, did that ever happen? Dear, I don't think that ever happened. No. But we certainly will say, well, I tried it. So you warn patients and you would keep an eye on these things.
Mike, quick.
Organic. Only contraindication of replacement, there are others, but is low adrenal functioning. And I will say it doesn't cause osteoporosis, for those of you that are thinking about that. And not when you are euthyroid, when you're in a good range of thyroid. Okay, well, let's venture into female land here for a little while. And this is kind of an amusing slide. This is the age of menarche in European girls during the past 150 years. So in 1820s, it was up around 17 and a half years when they began menstruating. And in 1990, it was somewhere around 12 and a half years. Pretty interesting. Again, it's all the xenobiotics, all the environmental estrogens, all the plastics, and the volatile organic hydrocarbons, all these things that behave like estrogen and causing all the girls to start. And yet, menopause has been around 50, been around the same age. As far as breast cancer is concerned, the big rate of increase is right at perimenopause. So your 46 to 50-year-old gals. Nearly every risk factor for breast cancer is either directly or indirectly associated with the increase in estrogens or estrogen receptors. And you can go crazy looking at all the things, including stress and different hormone levels and insulin resistance and obesity and poor diet and decrease in sex hormone binding globulin, increasing prolactin, decreasing progesterone. All these things increase estrogen and estrogen receptors. Here is a graph of the pre-pubertal, puberty, menopause, perimenopause, postmenopause. And here's progesterone, so you can see right at puberty it comes up, but it really drops down at the menopause and stays low. Here's estrogen right here, estradiol, around perimenopause, but look what it does right around perimenopause. So the estrogen can go up or they can be down. They can go all over the place. But progesterone's almost always down. So rule of thumb, I give every woman that walks into my office progesterone, unless it's really contraindicated or they just don't do well with it energetically. All right.
So what do you do with your female patients who have estrogen receptor problems what do you do with your female patients that come to you with estrogen problems and they have a whole bunch of white fillings in their mouths?
Well, like I say, with all these estrogenic compounds, all this plastic stuff emanating from their mouth, we do the best we can. So we do saliva, as we'll mention here in just a minute, we do saliva testing around the clock for cortisols, 8 a.m., noon, 4 p.m., and before bed, and look at progesterone, estradiol, DHEA, and testosterone routinely and serially, and I don't have a lot of them here to show you, but we measure and see what they've got. In my experience, everybody should be taking progesterone. It saves you from breast cancer and other cancers about 100%. And as we will see, it is also a great adrenal hormone. So back in 45, our stress guy, Hans Selye, demonstrated that progesterone has the full spectrum of regulatory and anti-stress functions of the adrenal steroids. And they do. We'll see again the adrenal cascade, how you've got cholesterol, pregnenolone, then progesterone, and dumps off all of the rest of the adrenal hormones. So they fall to low levels at menopause, and many of its positive effects involve its anti-estrogen properties. So it balances the bad stuff about estrogen. And estrogen dominance has a whole host of awful things: accelerates aging, immune disorders, breast tenderness. And breast tenderness is another sine qua non. It's progesterone deficiency or estrogen excess. Always. It's easy to take care of that. Endometriosis, we have had decreased sex drive depression for sure, especially PMS depression or hostility, anger, PMS, neuropsychiatric, is always progesterone deficiency and adrenal and thyroid, but always progesterone deficiency until proven otherwise. And we have homicidal women, PMS homicidal. It's totally squared away with a little bit of topical progesterone. Endometriosis, we've had wonderful luck with endometriosis. Knock on some wood here, fake wood. And, but it's, besides doing the Frankenhauser shots, which we love to do, we love neural therapy. We do neural therapy 12 times a day, 5 days a week, we love it. And outside of doing the Frankenhauser shots down into the hypogastric plexus, we've gotten rid of so much endometriosis just with topical progesterone alone. After women have had 5 or 6 laparostomies, laparotomies, and lasers, and it's still coming back. And it's just progesterone and trying to reduce the estrogen dominance, but just get rid of endometriosis like crazy. And fibrocystic breast disease, always, we'll show you some of the slides of that. Hair loss, hypoglycemia, infertility. I get a Michaela or a Michael named after me every couple of years. And it's just the hormones, folks. And a little thyroid, a little bit of progesterone, and kabam. And when I've had, 14 miscarriages in the last 20 years, and I just can't hold a baby, little progesterone, kaboom, Osteoporosis, of course, thyroid dysfunction, it helps to make the thyroid go better. Uterine fibroids, you can't disappear them with progesterone, but it slows their growth. Fibroids have a life of their own. They make their own progesterone.
Like, so say somebody that's getting estrogen replacement, okay, if they have too much, are you saying that if you just add progesterone, it's going to level them, or would you reduce the estrogen?
Yes. Both.
Well, I've had doctors tell me.
Well, we always add progesterone, no matter what. It just causes the cells to differentiate into their final form. Estrogen causes the cells to go into preliminary, undifferentiated growth, which you don't want. That makes the cancer stuff. So progesterone has so many good things about it, and guys need a little bit of progesterone as well. So we can either try to lower the estrogens by taking other aromatase inhibitors and changing the diet, or by increasing the progesterone.
Yeah, how do you do with the Frankenhauser for men that have bladder dysfunction as well as some prostate issues?
How do we do with the Frankenhauser for prostate and bladder dysfunctions?
Yeah, is that as effective?
Yes, I think it's very, very good. Certainly the Frankenhauser, where there's a number of ways to do it, and Dietrich's got some new ways. But you just go right underneath the pelvic brim with a 2.5 inch blunt 25 gauge spinal needle. Sounds gruesome, but it's very easy shot. And then you squirt your protein and Sabal and other homeopathics right down into the hypogastric or Frankenhauser plexus. It has been very helpful for men, but acute, gosh awful, the worst cystitis. I mean, burning hot poker cystitis, the worst, is instantly resolved with the Frankenhauser shot of Procaine, and I love it. And chronic interstitial cystitis is usually very much helped. And for those of you who'd like to this is kind of the other end of the business for you guys, but you can really shoot perirectally right up into the prostate too, which is probably a little bit more effective for prostate stuff in my experience, with Sanum remedies as well as Procaine. So liver makes estrogens, but alcohol helps its starvation, malnutrition, carcinogens, and fat makes estrogen, and estrogen makes fat. This is another horrible vicious circle in life. Fat makes estrogen, estrogen makes fat. And so once that's in there, and the adipose tissue, is making your reductases and aromatases, so it's turning all your hormones into estrogens. And especially guys, when the guys hit the andropause around 50, it starts turning your testosterone into estrogen. So guys start looking like girls around 50, breasts, tummies. So natural progesterone has been studied for a long time. I first heard about it from Ray Peat, PhD, up in Oregon in the early 70s. He got the work from Katrina Dalton, an English gynecologist. Of course, John Lee popularized it so much in his books. What your doctor may not tell you about menopause, what your doctor may not tell you about premenopause, and what your doctor may not tell you about breast cancer, which was co-authored with David Zava. And we love David. He's a wonderful guy and very generous with his educational materials. Now, again, progesterone is the most important hormone to supplement in most women. It stops dysmenorrhea, stops any pain of menstruation, stops PMS, stops swelling breasts. It's great for the libido. And there's almost always this relative estrogen dominance. Once again, we'll emphasize this more and more, but progesterone is not a progestin. It is not a progestogen. So progesterone is not medroxyprogesterone acetate. It is not Provera. Provera is the bad boy out there. That's what caused all the problems in the Women's Health Initiative HRT studies. And just happen to have this in here. There's hierarchies of evidence. The best thing is randomized clinical trials. And the worst is unsystematic clinical observation and expert opinion. So many of the people who are against hormone replacement therapy, even heaven forbid, the FDA, who's on the warpath against estriol, my goodness, which is the safest of all the estrogens, just basing it on, well, I'm chairman of the department of such and I say it's so. Or I'm president of the American Gynecologic Association and I say it's so. Without any good evidence. The evidence is overwhelming in favor of safety and efficacy of bioidentical hormones. And again, medroxyprogesterone acetate is not progesterone. So this is, and the media is starting to get it right. For years they said, Provera was a progesterone. It is not. We do like saliva testing. The accurate measures free hormone levels. It really mimics the levels that are in the tissues, the tissue level. And the serum blood test measure hormones that are bound to sex hormone binding globulin, the sex hormone binding globulin. And you cannot measure progesterone in when it's given topically. You have to measure the progesterone in saliva or capillary blood. Tissue progesterone, but it does not increase serum progesterone at all. So serum should not be used to evaluate the effectiveness of topically delivered progesterone. So this is a big bugaboo. The gynecologists are out there telling their women that walk in and say, "Doctor, I've had the greatest luck putting on this topical progesterone. It's cured all my symptoms of my PMS, my breast soreness, is everything better." And so he takes the serum level, and lo and behold, it doesn't change at all. And he said, "See, I told you that stuff's not doing you a bit of good." So progesterone rides around on red blood cells. You either got to have a capillary finger stick, or you have to have saliva levels. Otherwise, you won't find it. And this is a big deal that the gynecologists have yet to figure out in our allopathic brethren. So once again, progesterone protects almost completely against breast cancer, most menopausal symptoms, many of them, endometriosis, ovarian cysts go up and down like bubblegum, and they go down like bubblegum when you put on and cancer prevention, loss libido, dysmenorrhea, PMS, Also, it's great for functioning all the progesterone, such as mood enhancement, blood sugar support, fluid electrolyte balance, and stress management. You can apply it to the skin. It's great for facial skin, breast health, makes breast tissue firmer, stronger, fuller, and tighter. So it's nice for breast conditioning. It enhances collagen, keeps the skin smooth and tight. You got to use the saliva test. So we have too much estrogen, you have salt and water retention, synergizes the insulin to promote hypoglycemia and fat synthesis, opposes thyroid, promotes allergies and histamine release. Estrogen promotes blood clotting and embolism, and increases the incidence of elevated blood fats. There's a whole laundry list of things that progesterone is great for, including acne, allergic rhinitis, appetite disturbances, asthma, osteoporosis, tenderness of breast, fibrocystic breast disease, breast cancer, spontaneous bruising, capillary fragility, conjunctival retinal hemorrhages, constipation, colic pains, hemorrhoids, depression, edema, epilepsy, vertigo, fainting, glaucoma. So again, a long list of nymphomania there, bad one. Palpitations, paresthesias, facial pigmentation, erythema, toxemia, pregnancy, and I give it right through pregnancy. Absolutely. Pregnancy right along, it'll stop miscarriage if you give your progesterone right through pregnancy. Have so many gals, 12 weeks, 14 weeks, and they miscarry, then they start using progesterone, kaboom, right on through. It makes bigger, happier, healthier, smarter, prettier babies if you do it right along through the pregnancy. Can't hurt anything. The only thing about it is, don't tell your OB because he thinks you're using Provera, because he doesn't know what progesterone is. So he thinks you're using medroxyprogesterone acetate, which is totally contraindicated. He thinks it's birth control pills during pregnancy. So again, you have to not freak out your OB. So the 2 to 10% cream, very lipophilic. Vitamin E works. We give it in menstruating women day 12 through 26. Some people do 14 through 27. The menstrual cycles you can increase during the PMS time if it helps the symptoms. You can apply to already sized face, neck, breast, crease of elbows, inner arms, directly on painful breasts, always. And if they're postmenopausal, 25 days a month or 21 days a month, almost everybody likes a little bit of cycling to freshen up progesterone receptor sites. So this cream really works? Yes, it does. Steroids are low molecular weight, highly lipophilic, good candidates for absorption across the skin. Use of transdermal basis is not really required for absorption. It's one of the very best things. Next to the bottom here is progesterone, estrone, pregnenolone, testosterone. These guys are highly absorbed going across the skin. And here is a study showing after a dose of progesterone here, what happens to the saliva and what happens to the serum. So it's no wonder our allopathic brethren are not impressed with topical progesterone. You have to look at the saliva. Here's a liposomal membrane, which are layers of fats inside fats, of phosphatidylcholine. And this does improve some deliveries of some hormones. And you can put lipophilic anything. I love one of our buddies, Michael Borkin of Saber Science Labs. I don't know how many of you guys know Michael, wonderful guy. And he's always coming up with innovative things. And they measure saliva testing and put very complex mixtures of hormones together and deliver them transdermally, and vitamins and amino acids. So now he's added vitamins to his transdermal creams, his liposomal creams, in a soap. So for third world, for those of us, for kids, I don't want to take my vitamins. Well, here, take the soap. You got to take your shower, take your bath. So killing two birds with one stone. I thought that was very clever. He's in the process of patenting that right as we speak. Well, they found that women who had infertility due to breast progesterone deficiency were 5.4 times more likely to get breast cancer. And people who were progesterone deficient had 10 times the death from all malignant neoplasms. So progesterone saves you from cancer. Everybody should take it. Guys, a little bit helps your prostate. And this is from American Journal of Epidemiology, 1981, so it's a while back. Now I had my nice new all-color thermography slides, but I had this old one. This didn't make the cut into this traveling show here, but this is thermography, and you can see the, hard to say, but this is a sign of a lot of heat in this breast right here, which is what we're looking for at thermography, because the heat is following little blood vessels that may go to new cancers. And following progesterone therapy, you can see how the heat went out of this breast here. So I have a set of 5 nicer looking slides, but it shows the same thing. We can get high risk patients down to much lower risk. And side effects, occasionally acne, occasionally allergic reaction, can change the nature of the period. It can make the period earlier, later, longer, shorter, lighter, heavier. So you need to adjust. And for hot flashes, some people like it every 15 minutes for hot flashes. In this study in cancer detection and prevention in '99, it showed that topical progesterone, 100 milligrams a day, which is kind of a lot, showed no increased breast cancer risk compared to never users in a cohort of French women. And here's Kenna Stevenson's article, and Kenna, if you ever get a chance to hear Kenna, she is just a real riot. And wonderful researcher, gorgeous gal, very wonderful healer on many, many levels, but she works at the University of Texas near Austin. And this was in Circulation, and found that transdermal estradiol and progesterone improved mood indicators, quality of life, biomarkers of cardiovascular disease, and perimenopausal and postmenopausal women. And she's really championing this whole idea of bioidentical hormones, and she has a bibliography on this at Choke a Horse. I mean, she's got a 50-page, 2-page bibliography just on bioidenticals. So estrogen, the angel of life, the angel of death, depends on how we deal with it. So for women who are always facing this estrogen question, there's some few things you need to know about estrogens. We love estrogen, gotta have it mostly, and again, it's gonna retard this aging program, or the aging problems. All this stuff started back in '02 in JAM with the Women's Health Initiative, when they saw that at a 5.2-year study that they had a 41% increase in strokes, 29% increase in heart attacks, 26% increase in breast cancer, and a 22% increase in total cardiovascular disease, and a doubling of blood clots when women were given Prem-Pro. So Prem-Pro is conjugated equine estrogens, which are from horses. As you know, they tie up the horses and get their urine, and that's where Premarin comes from, if you didn't already know, is from horses. And there are hundreds of equine estrogens that have never been studied in Premarin. And the Pro, of course, is medroxyprogesterone acetate, which turns out to be the real bugaboo. Actually, when you look at the numbers on the studies, out of 100,000 women, there was the baseline, there was some 13,000 women in the placebo control group that got breast cancer, and then maybe it was 23,000 in the Prem-Pro group. So out of 100,000 women, it's actually not that many in numbers, but the percentage was quite an increase. Again, if you want to know about female hormones, you should read this breast cancer book by Lee and Zabit. They're about to do a remake of this, which is a little more charitable for estrogen. Well, we won't go through all the quinone reductases and all the glutathione conjugates having to do with the different types of estrogen. But if you can just follow along here, E2, remember E1 is estrone, there's 1 in it, estrone, 1, estradiol, 2, estriol, trio, 3. So it's E1, E2, E3. So E2 is estradiol, goes back to E1, which is estrone. This is all that came out of original progesterone. But this then, what we want is to metabolize estrone out through the 2-hydroxyestrone pathway that goes through these 2 quinones and forms DNA adducts, DNA repair, and no further effect. And this is facilitated by I3C, indole 3-carbamol, which is a cruciferous vegetable extract. And actually these days we are liking even better sulforaphane glucosinolate, which is a broccoli seed extract concentrate. 1 capsule of sulforaphane glucosinolate equals 6 pounds of broccoli eating per day. And it causes by itself, it causes apoptosis of breast cancer, prostate cancer, colon cancer, liver cancer, stomach cancer, and melanoma. It has over 300 studies done on it. So if you look up oncoplex, you'll find sulforaphane around. And if anybody wants any studies, call my office. I'm happy to ship them out to you. But we're trying to avoid going to the 4-hydroxy pathway, which goes to the 4-hydroxyquinones, and then this causes DNA damage, mutation, and cancer. So if we can use estradiol safely by getting it out of the body through the safe pathway, then we can have the best of both worlds. And estrogen's wonderful stuff, and all the great things that it does for you. Now, progestins and progesterone hormone replacement, basically this causes, the upshot is the Provera causes cancer. Almost all observational studies published over the last 5 years report increase in breast cancer associated with progestin use. It's the medroxyprogesterone acetate that's the bad boy, not even so bad as the Premarin. This is Journal of Steroid Biochemistry and Molecular Biology 2005, Campagnola et al. Here is a look at progesterone upper left here, and here's testosterone, and here's medroxyprogesterone. So they are different molecules with different side chains off the steroid nucleus. And all the other norgestrel, norethindrone, norethindrel, all these other guys, all the synthetics that were developed to be patented. You can't patent progesterone. Been around too long, so you can't make any money on it. And this was another one by Stahlberg, the International Journal of Cancer Therapy, so that they, again, statistically found higher risk of breast cancer with cycled in combination with progestins, with a bad guy here. And again, another study by Campagnola. Progesterone does not have a cancer-promoting effect on breast tissue. We therefore suggest among human hormone replacement therapies indicated preparations containing progesterone and not a synthetic progestin should be used. In this way, the risk of endometrial cancer is also minimized. After Prem-Pro, the Scare Prem-Pro came out in 2003, there was a 50% reduction in the number of women using hormone therapy, and there's a huge drop in the massive number of women discontinuing hormone therapy. There's a huge drop in the incidence of breast cancer. Well documented 50% reduction in the number of women using it with a big drop. Now again, this comes from Kenneth Stevenson, who noted that conjugated equine estrogens and medroxyprogesterone acetate Prempro, that these guys cause a decrease in fibrinogen, increase in factor 7, factor 7A. These are all clotting factors, and they increase C-reactive protein and interleukin 6, and so it's prothrombotic. And this was in Chest in 2002. People using progesterone looked at thrombotic and anti-inflammatory factors, found no change in factor 5, 7, fibrinogen, antithyroid 3, PAI, C-reactive protein, TNF-alpha, interleukin, and gave relief of menopausal symptoms. So regular progesterone does not cause the inflammatory or thrombotic problems that Provera causes. Now, we love estrogen. Estrogen is wonderful. It causes all these great effects. It aids in amine synthesis, and so menopausal women, if they're crying without reason, sitting around crying for hours, nothing's wrong. It's estrogen. They're estradiol deficient. And you give it this sine qua non for needing some estrogen is the lady that's sitting around crying all the time. And she needs her estrogen. She wants to go she's just crying. What are you crying about? I don't know. It's sad. My husband went to work today. Oh. So, when you take estrogen, it boosts serotonin 20%, right across the board. Well, so it's really related to your neurotransmitters, both ways. It goes back and forth. Enhanced serotonergic tone, your gut works better, your mood's better, your blood sugar's better, nerve growth factors are better, autonomic nervous system decreases the sympathetic tone, Not so much as progesterone. Progesterone is the major relaxer. So we always like to give progesterone before bed if we can. But progesterone's parasympathetic, makes you relax, makes you happy, slows you down. And estrogens, by and large, zip you up. Put on the norepinephrine and the dopamine, get you going faster. And again, little ladies that cannot stand any sympathetic stimulation, a lot of them can't take estrogen, even small amounts. It'll zip them out. They'll just be wired. They can't stand it. And it promotes epithelial, cardiovascular factors, antioxidant effect, lipid effect, decreases LDL, increases HDL, inhibits osteoclastic formation in bones, what helps bone, improves insulin sensitivity, and promotes gene expression of longevity genes. So estradiol, angel of life. So need a little. So estradiol and estrone are metabolized into catechol, as we mentioned. Estriol does not follow the same pathway generally. Jonathan Wright, our hero from Kent, Washington, measured normal healthy young women back in the 70s and found their blood contains 80% estradiol, 10% estradiol, 10% estrone. He named it Triest. And for years we've used Triest, and it does work for a lot of ladies. Some it doesn't. It's just not strong enough in estradiol to stop flashes and other autonomic effects of menopause. Melatonin reduces your estrogen needs by about 2/3, so adding a little melatonin in helps. So the two are together, Triest and progesterone. They create a safe hormonal harmony in a great majority of female patients. Some women don't need extra Triest because progesterone can sensitize the body's estrogen receptors to make them more efficient to respond to adrenal and external estrogens. Some ladies have enough of their own estrogens. Do you ever have hot flashes? No, not to speak of. How's your sex drive? Pretty good. How's vaginal dryness? Not a problem. And then you measure their estrogen levels, they're in normal range. So a lot of postmenopause women don't need estrogen, they just need a little progesterone. Now biased 80-20 with no estrone, which is 80% estriol and 20% estradiol. And people go up to 50-50 of the biased, 50% estradiol and 50% estriol. Estriol is the cat's meow for vaginal dryness. If women say, no, my mother died of breast cancer, I'm not taking any of that funky estrogen for sure. But they will take, they're complaining of dryness, vaginal dryness, they will like a little estriol cream with a vaginal applicator, just works great. Now, subsequently in the last 4 or 5 years, we've really been into the estradiol patch, the Vivel dot. And it took us a long time to get here because I was such a John Lee devotee that I thought estradiol automatically was just rude, bad, and caused malignancy. It's not so. If you give the I3C, the DIM, diamyl methane, I3C, indole 3, carbamol, calcium D-glucarate, or sulforaphane glucosinolate, and all that, then it's going to take it out of the body through the 2-hydroxyestrone rather than mean and nasty 4-hydroxyestrone pathway that causes problems. And for the ladies, don't forget the testosterone cream. Gals need testosterone, especially if you give them the progesterone, the estradiol, say, Doc, I don't know, you told me my libido is going to do better, but it's just not doing anything. And you can give them a little estrogen cream, and they just think this is great. Again, hubby thinks it's great, too. And ladies are touchy, you just have to start with from 0.5 to 3% cream, 1/4 teaspoon, the groin, labia area, or creases. And if it overdoes, first thing it does is it promotes acne. And they don't like it. And also facial hair. Then I have ladies who say, I don't care how much facial hair I get, I love the libido. I'm going to get waxed and I'm going to go to the laser person every month. I don't care. I want my sex drive. So ladies like their sex drive. And it gives, as Terry Hertog from Belgium, the very famous endocrinologist, says, it gives them firmness of mind. Firmness of mind. Now back to adrenal. We'll zip through adrenal here pretty quickly. Adrenal sits on the kidneys, and this is my #1 favorite gland. I've been working on adrenal. And everybody that comes into my office, their adrenals are blown, one way or the other. Either sitting on cortisol, adrenaline rocketing high, they're on 12 cups of coffee a day, and 2 or 3 packs of cigarettes, and they got a busy business person, the phone is ringing, the kids are screaming, and they're just on this adrenaline high, and they've done this for years and years. And they're proud of the fact that they only sleep 3 or 4 hours a night, and they get more done than any other 7 people in their office, is because they get up at 4 in the morning and they start doing projects. And we don't ever sleep, we don't need to sleep. So of course they can't sleep because their blood sugar is so low at night that their adrenaline kicks in for gluconeogenesis to start the fat being turned into blood sugar so they don't die. And here's this adrenaline rush, it keeps them up all night. And we see this all the time. So when the adrenals, then the adrenal goes completely weak, and you can't even run on adrenaline. And that's when we see it. Can't get out of bed, doctor, I'm completely exhausted. So when the adrenal's down, anxiety, irritability, fearfulness, fear, horrible, gut-wrenching fear. And it's not lack of an antidepressant, for God's sake. It's their adrenals are blown. Irritability, weakness, faintness, insomnia, palpitations, tachycardia, epigastric distress, fatigue, headaches, anorexia, diarrhea, vertigo, confusion, poor memory, frustration, amongst many, many symptoms of adrenal fatigue and adrenal stress. Very, very, very common. And this adrenal and thyroid and sex hormones in the first visit, when I see people, and 2 weeks later, they think I'm walking on water, generally. Kind of, sort of, sometimes. So it's amazing what you can do in 2 weeks with folks. And I started out, well, we're going to clean up your diet now. Let's get right over on to organic foods. As the patient yawns and their eyes roll back in their head, doc, I can't do that in my job, where I live. So the hormones give you fast results, and then you get people's attention, and it's quite amazing, I find. They have a new book out, I guess last few years, by James Wilson called Adrenal Fatigue, the 21st Century Stress Syndrome. And I usually have my patients buy it. I don't love everything he says about how to resurrect them, but he doesn't give anybody back hormones. He only does diet and lifestyle and vitamins. And says, okay, 3 to 6 months, you're going to start feeling better. May take 2 years. And and I don't know about you guys, but my patients, if he says, the dental work's going to take 2 years to get done, so, well, I think I'm going to walk down the street and check something else out here. Give me drugs. I don't want to do that. But no, I think you do need to do adrenal rebuilding, and it is important to do right along with giving adrenal support in terms of glandular support, hormonal support. But I have the patients read this book and they go, oh my God, they wrote that book about me. I'm all through there. That book just totally describes me. Everything in there. So he calls it also, we call it subclinical hypoadrenia, not Addison's hypoadrenia, subclinical adrenal exhaustion, neurasthenia, hypocortisolism, and functional hypoadrenia. It's just, we're taught in medical school that you got Addison's disease on one hand, and then you've got Cushing's syndrome on the other, and that's the only 2 adrenal problems that you've got. Either the patient shrivels up, turns brown, and dies, or they puff up and get moon face, the buffalo hump, and thinning in the skin, and ulcers, and then they die. So there's this huge, that's about, 1/10% of everybody. The other 99.9 are in this middle range of subclinical hypoadrenia. And it's related to fibromyalgia and chronic fatigue and arthritis, autoimmune and cancer, survival and AIDS, and asthma and flu, the post-flu syndrome. I can't get going again after the flu, doc. I just don't have any juice. I have no energy. I had the flu. It was bad for 3 days, and I'm up, but I just feel awful. I can't come back. Because their adrenals got blown out by the viral load. Bronchitis and pneumonias. Yeah, I always like to tell the story about when I was in college and med school, I had bronchitis for 10 years because I was smoking. As soon as I started taking a little bit of thyroid, I never had it again. 35 years ago. That's about it.
Take the full slide again.
Yeah, especially AIDS survival, cancer survival. If people are just exhausted and they give up, and then you have to really support that adrenal gland. We'll kind of talk about that in just a second.
If you've been told your adrenals are completely blown out, dead, non-functioning, and never will they again? I mean, I've been on this stuff forever, but I'm not doing it.
Well, you have to take all the straws off the camel's back. And, if you got, scars, perhaps let's just say that you have scars that are crossing the midline right in through here, through your kidney meridians, any place across your front. If you have, any unresolved dental issues, and you've got you're pouring toxins out through, God forbid, root canal issues, or you've still got issues with your dad, or you haven't forgiven what the kids said about you in the 8th grade, and you have past life entities that are still drawing you down. All of these things have to be dealt with in order to heal the adrenals. So there's all the straws on the camel's back. So on every layer of health and healing, it all comes down to old adrenal, heavy metal, free radicals. You're working in an office that's not ventilated, the windows won't open, the formaldehyde's coming out of the rugs, and the mold will just kill you. And so there's just all these levels of stress and toxins that are in people's lives. So you've got to be a sleuth and pick out all of the toxic exposures. And when you have adrenals like that, you've already been in the business of trying to get them all out. So then there are people, as you have read in in the book, The Safe Uses of Cortisol by William M.C.K. Jeffries. Dr. Jeffries was the co-discoverer of cortisone in 1949 in the Mayo Clinic. And he found that, he wrote the book, when cortisol first came out, hydrocortisone compound E, that they would give people a shot of 200 milligrams of hydrocortisone, and he popped those rheumatoid arthritis right out of the wheelchair, and they go dancing around the parking lot. And we thought, oh boy, this is the best thing since sliced bread. And 2 months later, they all started developing Cushing's. And said, oh man, this stuff's really bad. This is poison. So he wrote the book as a reaction to the reaction against cortisol, and he found that there were some people that just did not function at all because their adrenals were blown out unless they did 5 milligrams of cortisol, hydrocortisone, Cortef, 4 times a day. And if they got sick, viruses, 10 milligrams 4 times a day, and they would lead absolutely normal lives except they just needed cortisol. And so, some people may need it. It's hard to say. We're always trying to improve people, make them better, vitamins, nutrients, herbals. We're trying to strengthen adrenals any way we can. And then usually the degree of adrenal support that is needed diminishes. So it's just always this balance of how far we can go with it. Weak heart functions, lack of stamina, emotional paralysis, fearful, post-traumatic stress, poor wound healing, susceptible to infection, alcoholism, perimenopausal and menopausal syndromes, PMS, allergies, sensitivities, chemical intolerance, unresponsive hypothyroidism, persistent of hypothyroid symptoms despite treatment with thyroid hormones. So I have big guys come in and say, I've been reading all these books for years on hypothyroidism, and I'm doing 6 grains of thyroid, and I don't feel anything. And my thyroid blood tests are still kind of normal. My TSH is a little low, but these are always signs that you need to put back some cortisol or adrenal support, and that's when they'll get the energy back. Collapse after hearing bad news. That's also a great time for homeopathy. Loss of motivation, general feeling unwellness, the chronic fatiguers, overwhelmed feeling, jet lag, progressively poor athletic performance. These are all low adrenal signs and symptoms. And John Tintera, in his book, Hypocortisolism, back in 1974, thought that 60% of the population had some moderate to severe degree of hypocortisolism with hypoglycemia. But in actuality, the figure should read 67% if you take into account all the arthritis, asthmatics, hay fever sufferers. I mean, what do the asthmatics take? Cortisone. Where do you get cortisone? Adrenal gland, adrenal cortex, the outside. And if they're bad, you give them adrenaline. Where's that come from? Medulla. Norepinephrine, right in the middle of the adrenal gland. So, if your adrenals are bad, you're more likely to be allergic and more sensitive to the environment. So when you see a decreased T3 with a normal T4, it can be adrenal fatigue. And moderately or severely decreased TSH, but with clinical indications of hypothyroidism, think about hypoadrenalism. Again, we like the saliva test for the adrenal, DHEA, progesterone, estrogen, and testosterone, although I usually do for men more the serum testosterone and free testosterone, since SHBG, binding globulins, and estradiol. Now, once again, just I know you all know this stuff, but here's cholesterol. And why do we love statin drugs? What do statin drugs do? They kill this whole thing. You know, the statin drugs. And I have to, oh my God, I just get people on like 2 statin drugs. And the guy just said, I want to get all these drugs. I don't know what it is. I can't walk. I just feel awful. I've got no energy. I feel like I got the flu. And my legs hurt all the time, and I can't walk, and I can't. And I don't have any libido. I don't have a 6 pack, and I don't care. And give me a Pepsi, please. We call it, as a religion, we call it their whiskey. Don't want to say it. All right. Okay, so how are you going to make your progesterone? Here's your testosterone down here. Here's cortisol. So we always like to say that when the tiger is pursuing you through the veritable jungle of the world, that you're working on your cortisol and your reserve blood sugar manufacturing energy. And so it sucks all your other hormones to it. The body will make cortisol no matter what, just to stay in the ball game. So it sucks the testosterone, the androstenedione, androstenediol, DHEA, pregnenolone. It all gets dumped into cortisol. And so no wonder I'm not sexy, especially girls. Girls make most of their testosterone in their adrenal glands. And so if they're completely stressed out, 3 kids, 2 jobs, funky husband, they don't, no vacations, no sunshine, there, no nutrients. Of course they don't have a libido. So you take the stress off, put the adrenal back, and back comes the libido. So adrenal remedies we've talked about: a rest, vacation, improved sleep, breakfast, and again, not a Pepsi and 2 Twinkies. I was telling the story today. I had a bad seizure patient, and I'm always taking nutritional history, of course, and I kept asking what he eats. He said, "Oh, not much." Well, what do you eat? I don't really eat much. But I mean, what do you eat? I have a hamburger occasionally. And I said, well, how about soda? He says, oh yeah. How much soda do you drink? Oh, I drink 6 64-ounce Pepsis a day. Uncontrollable seizures. And my wife got him going on some burritos to put in. He worked at a truck repair place. So just go to the microwave and stick some burritos in that microwave, and you'll feel much better, man. He did. Stop breaking through. So we need vitamins A, C's, B's, especially pantothenic acid is big for the adrenal glands. High protein diet, salt, and again we could take a day to talk about salt. But if you haven't really gotten into Celtic salt lately, we like Himalayan, we like real salt, we like kosher salt. But Celtic salt has 16% trace minerals, and that's what you really want to go for. Everybody, when your adrenals are weak, you leak. That's one of my other chronic wheezes. Because when your adrenals are weak, and here's aldosterone down here in the bottom, and so you're not making your aldosterone either, and out go all your sodium, hold on to your potassium, out goes the magnesium, the zinc, the manganese, the chromium, selenium, all going out, and neurotransmitters. You'll pee out neurotransmitters, they go out this way as well. So when your adrenals are weak, you leak. I mean, that's why I have to go to the bathroom every 30 minutes, doctor, and I'm up 4 or 5 times a night. Well, besides your prostate, of course. When your adrenals are weak, you leak. Again, we want the butter, the good butter, want the cholesterol in there. Now, the adrenal gland extracts I've liked a lot, and I've injected them for 33 years. And I also like isocorts. I can say isocorts here. This is a Bezwecken product from Oregon. Isocorts, it's the adrenal cortex of sheep from New Zealand that are organically grown and humanely abattoired. As humanely as that goes. And so, but each one of these has 3/4 of a milligram of hydrocortisone in it. So your average person can do anywhere from 1 to 8 of these guys 4 times a day. And it's absolutely marvelous energy to work with. They got blood sugar for 4 or 5 hours. And it works absolutely wonderfully well. We'll talk about DHEA, maybe not, I don't know if we'll get around to it. Dehydroepiandrosterone is one of the mother hormones of the adrenal cortex, and it also gives you a lot of energy. 7-keto-DHEA is more expensive, but it has the property of not turning into estrogen. Regular DHEA can go anywhere it wants in the adrenal gland. 7-keto does not go to estrogen. And again, especially for the guys, it's better not to go to estrogen. Androstenedione, pregnenolone, progesterone, all help the adrenal gland. Now, we work with, over the last, again, 3 years, injectable hydrocortisone and sesame oil and adrenal cortex, but it's mostly hydrocortisone by volume. 2 to 4 milligrams per week in a sustained release injection in sesame oil. And this is just miraculous, People sleep, the anxiety goes away, the heartburn goes away, the gastritis goes away, the headaches go away, and the fear goes away. It's absolutely quite miraculous. It balances the thyroid. They can take a little thyroid without getting hyper and wired, and they feel just wonderful. And people have never felt this good doing a little adrenal, a little thyroid, the gals a little progesterone, and the guys a little testosterone.
What about the adrenal cortex, gland extract?
Yes.
Talking about the usual cortimorphogens or stuff?
No, this is the
Everything.
whole adrenal gland of a cow, and it's the FDA decided that they didn't like it in about 1978, but it has been around, I can tell you. The agent back. But it's but mainly it's hydrocortisone, and you can use hydrocortisone pretty irreplaceably with it. So adrenal extracts have been around since the 1920s. It used to be in rat swimming units. You adrenalectomize a rat, put the rat into freezing water, and see how long it took until the rat drowned. Seriously. This was done at Yale in 1921. Then they would inject hydrocortisone in it and see how long, or aqueous, they would use adrenal extracts injected into the rat, and they would see how long the rat would stay afloat. And that was the original units of adrenal cortex. And as I mentioned, cortisol, hydrocortisone, Cortef tablets, 5 milligrams, are really helpful in some people. It's like anything. Sometimes somebody walks in with a screaming, bleeding colitis with 35 bloody mucousy bowel movements a day, and you really have to go to the 40, 60 milligrams of prednisone, even though you don't like it, while you are trying to get them under control. So there are the cortisol, or time-release cortisol, is sometimes necessary. You start with diet, fresh air, clean, sunshine, rest, nutrition, then you work up to cortisol. So it's this continuation of therapy, continuum of therapy in the adrenal glands. And again, you can take, I like the Bezwecken tablets, I think are very good. You can take whole adrenal tablets, which are available at any health food store. These frequently have medullary components to them, which means they've got adrenaline in them. And if you go by the old cup of coffee, rule of thumb, Mrs. Smith, how much coffee can you drink? Oh, I can't drink decaf. I would be up for 2 days. My heart would pound out of my chest. They cannot take stuff with adrenaline in them. The big, 300 and 400 pound guy, sure, you take 8 of them a day, doesn't bother them. It's just huge a bell curve of responsiveness to adrenal and thyroid preparations. All right, guys, low testosterone can cause nervousness, grumpy old men, irritability, insomnia, depression, antisocial tendencies, leave me alone, even crying, I don't know, suicidal, midlife crisis, inability to concentrate, weakness, fatigue, muscle pains, muscle loss, weight loss, constipation, decreased urinary force, urinary frequency and hesitancy, reduced sex drive. So lots of stuff comes with andropause. It sneaks up on you. I always like to note that when men's sex drive goes away, they don't care that it left. That's a sign that they're low testosterone. If they don't care, they don't have a sex drive. Same thing with girls. I don't care. I don't miss it. Of course not. They don't have any testosterone. So for men, andropause is slow. Women hit menopause, kaboom, 2 months. They're there. Hot flashing, crying, vasodraitis, water retention, hypoglycemia, boom. Men, start late 40s and can really hit it early 60s. But it's so valuable. Testosterone has so many wonderful things. I'll try to get through this real quickly. Of course, erectile dysfunction, loss of sex drive, vitality, depression, osteoporosis, all these guys. We have to remember again the aromatization of the male testosterone, the xenobiotics like DDT, DDE, aldrin, PCBs, formaldehyde, and plastics cause excessive estrogens, which go against the testosterone. But for years, people have used the injected time-release preparations like testosterone propionate or cypionate, 100 milligrams every week or 100 every other week. And again, the topical creams apply do well to the groin and face. And of course, we never want to take methyl testosterone or estrotest in the girls because methyl testosterone causes liver cancer, and you absolutely want to avoid it. Of course, you have to do your good physical and make sure your PSA is in a good spot and do a digital rectal exam. A lot of people believe that BPH and prostatic CA, which is an old man's disease, can be prevented by testosterone supplementation. I do. It does not cause enlarged prostate, just giving testosterone. Slightly bigger size, no increase in PSA. If you have a very low PSA, like a 0.4, 0.6, this is a sign of low testosterone. If you take testosterone, it can cause some testicular atrophy, only about 10 or 15%. Male pattern balding if you don't block the conversion to DHT. Regular testosterone doesn't cause it. Gynecomastia if you get too much. The major thing to watch out for is elevated hemoglobin and hematocrit. It causes blood to be manufactured, and guys need to donate blood once or twice a year to keep that hemoglobin under 18. Occasionally you get some roid rage if you get it too high, but it's most likely it'll help your blood pressure. Occasionally priapism, continuous erections, that's unusual, and that usually increases libido. If you ever get a chance to look up Eugene Shippen's book called The Testosterone Syndrome, he's got acres and acres of data. I've just heard his lecture from the A4M in Las Vegas. Wonderful stories and case histories about the use of testosterone in both sexes. So decreasing testosterones are associated with increased cholesterol and triglycerides, and it increases arterial plaque, increases coronary vasoconstriction, raises blood sugar, increased insulin output, which leads to obesity and diabetes, increased abdominal fat, increased estrogen levels, and increased lipoprotein A. So testosterone has a great effect on the inflammatory system and on the vascular systems. Wonderful stuff. And we have to continuously remember that the heart is a muscle, and the heart loves testosterone. There's a greater relationship to people over 70 that have cardiac events that have low testosterone versus high cholesterol. So testosterone, wonderful stuff. All smooth and striated muscles respond to testosterone. The most common one is the heart, followed by the muscles of the neck and shoulders. Again, the stooped appearance of men like this and the kyphotic look. It's low testosterone in men. Aromatases increase with aging, zinc deficiency, obesity. Now, people that do take the testosterone shot, a lot of it will be aromatized into estrogen. So you need to take an aromatase inhibitor. A lot of people these days are recommending Arimidex, 0.5 milligrams twice a week, or 1 milligram a week. And it stops that conversion of testosterone into estrogen, which we don't like. Younger guys under 40 can get their own testosterone doing better by doing nice things for their system. And many drugs, this is very important, inhibit P450 enzymes, including non-steroidals, Tylenol, aspirin, antibiotics, antifungals, cholesterol-lowering drugs, antidepressants, antipsychotics, heart and blood pressure medications, calcium channel blockers, high-dose vitamin E, actually, dietary deficiencies, grapefruit, alcohol, amphetamines, marijuana, and cocaine. So many of the drugs, people walk in your office, 12 medications, their testosterone is absolutely blocked, and which then it leads to other issues. I would tell you one quick story of Gene Shippen had a patient, 56-year-old accountant with chronic ulcerative colitis with bleeding and 8-10 stools a day. He was maintained on 40 milligrams of prednisone and 8 or 10 azolfidines a day and ribavirin. And his GI guy said, "I'm sorry, you just really need to have a colectomy now. We're going to put you on a pouch. We've done all we can do." Well, not feeling so terrific about that. He went to Gene and Shippen, and he put him on 400 milligrams of testosterone IM twice a week. And within a year, he got off all of his anti-inflammatory meds. His colon and his colitis were totally normal, and he was down to 50 milligrams of topical progesterone a day. So, great things can be done anti-inflammatory-wise, breathing-wise, MS, all these neurological illnesses can be greatly helped.
Even the bisphosphonates for their osteoporosis, and we know that head and neck surgery, that's going to cause a problem if it's IV. Are we at liberty to tell our patients to check with their physician or OBGYN to try to get a progesterone type patch as opposed to taking something like Fosamax?
Except they don't even know what he knows.
No, absolutely. The bisphosphonates cause weakness of the jaw muscle. As you guys may know, if you do an extraction of big hunks of jawbone can come right out. And so it weakens the maxillary and mandibular bone structure. So you bet we'd all want to do progesterone, estradiol, testosterone, vitamin D therapy, high dose, and weight-bearing exercises before we did the bisphosphonates. Michael?
One of the problems that you have with bisphosphonates, I would strongly suggest anybody in this room that does oral surgery, don't touch that patient. Send them to an oral surgeon. Do not touch that patient. I had a lady give me cash $6,000 for a surgery, did not tell us the drug she was on, and her problem was bisphosphonates. She cannot heal. We gave her back her money and told her the problem that she had and referred her to an alternative doctor. But fact of the matter is, if they have bisphosphonates orally or IV, don't touch them.
Dr. Meyer, do you mind if I give folks a political legal update on this issue?
I don't mind.
Go ahead.
Okay. Dr. Gerber alluded to it. The FDA is now saying that you cannot compound. I'm Carol Peterson. I'm with Women's International Pharmacies, so we compound almost exclusively bioidentical hormones. So the FDA is saying this on the basis of compliance guidelines that they made up. Compounding pharmacies generally use as their guidance the U.S. Pharmacopoeia. We are allowed to choose any substance. Practitioners may choose any substance they deem medically beneficial for their patients. They are not limited to FDA-approved drugs. They're not limited to the whims of the FDA, albeit the FDA would rather you not believe that. So, have you seen the big full-page ads in the Wall Street Journal, USA Today? Several of the alternative medical organizations got together and protested. We currently have a piece of, a trial. On January 18th, we were in New Orleans. We, with some other pharmacies, had sued the FDA on the basis of their new idea that all compounded drugs must go through the new drug process. All. I don't know how many of you use some compounded drugs in your practices. You probably have some opportunities and can be very beneficial. These are all being attacked. So we just had, we won the first round, took part in Texas and New Orleans. It was heard, the FDA took us to the circuit court, and we have about 2 months before we'll get a decision on that. Hopefully it's favorable, but I think this might go to the Supreme Court. In the meantime, there's been quite a lot of activity going on. If you check our website, women'sinternational.com, or Dr. Gerber alluded to Kendra Stevenson's very active with womeninbalance.org, or the lobbyist organization for compounding pharmacies, which is the International Association of Compounding Pharmacies, to get up-to-date information. But what it looks like right now is very shortly we will probably have to seek legislative relief from all this to keep it going, and we'll need everybody's help. So please keep looking for it.
Thank you very much. Let's keep our compounding pharmacists going. Bless them. Thank you.